Most parents of little ones can relate to this. Your baby is fussy and you're not sure why. Maybe it's an ear infection. More than 90% of children will get one at some point. Fortunately, the experts at Charlotte Eye, Ear, Nose and Throat Associates can help, whether the ear infection is a one-time thing or a chronic problem. Well, they make kids feel crummy and it causes parents to worry. We're talking about ear infections. Joining me now is Dr. Tim Kelly from Charlotte Eye, Ear, Nose and Throat Associates. And just exactly what is an ear infection?
Ear infection is an acute inflammatory process of the middle ear space. So when we talk about the middle ear space, this is the outer ear, of course. This is a model with the canal, the tympanic membrane or eardrum. And this space right here is called the middle ear space. An infection of that space is acute otitis media.
So how do you diagnose an ear infection? I remember when my kids were little and one of them had an ear infection for weeks and I had no idea.
Not uncommon. Most kids who have an acute ear infection or acute otitis media, they're sick. So cranky, irritable, has a fever, maybe a runny nose, and then exam. So the child comes into the office, you look at their ear. Typical ear, it's bulging, red, inflamed, kid's not happy.
Okay, so how do you treat them?
In general, for the kids that are ill, we'll give them antibiotics. The issue there, though, is that about half of ear infections are not due to bacteria, so an antibiotic won't work. The other half are viral. So now guidelines show that if a child is really ill or very young, we'll give antibiotics. But if they're fairly asymptomatic, we may just observe and see if the fluid resolves on its own.
All right, talk about tubes. At what point do you use tubes to help a child?
It really is a numbers game for me. And basically there's guidelines from our academy that deal with that. 4 to 6 infections in a 12-month period or persistent fluid for 3 months or more. These are 2 examples of ear tubes. This is a very small one that we frequently will put in the office, mainly in adults. This is more typical of the type of tube that we put in a child in surgery. Very safe procedure. It's actually the most common surgery in children in the United States, 700,000 cases a year. But basically it's done under general anesthetic, so the child is asleep. There's no IV, there's no shot, there's no breathing tube. They just breathe a little mask called sevoflurane, and it takes about 15 to 20 minutes.
Talk about the benefits and what that means. I mean, once a child has tubes, does it mean he or she will never get an ear infection again?
Great question, but no. Kids do still get ear infections. In fact, about 15% of kids will still have some intermittent drainage from their ears. That drainage is something that parents can see, so they can treat it on their own if they have the drops that we give them at the time of surgery. So therefore, they don't have to go into the doctor, incur a copay, take time off from work.
Are there things that parents can do to keep their kids from getting ear infections?
Keep them healthy. I mean, that's a hard thing to do, but keep them away from other sick children. Avoid secondhand smoke. Treat allergies if they have those. But basically, it's really a genetic thing in a large part. So if parents both had ear infections, both parents got tubes, chance the child's going to have ear infections, and it's just luck of the draw.
Bottom line, Dr. Kelly, what do you want viewers to know when it comes to ear infections and what you do here at Charlotte Eye, Ear, Nose and Throat Associates?
Well, I think we do a great job at taking care of the children, and that's really our goal. We want to prevent them from having complications from ear infections. We want to make sure that they're hearing well. We want to make sure that they're basically having a good quality of life. I think, do a really good job of taking care of that, but also dealing with some issues that may occur with ear infections that are unusual.
Great. Thank you so much for your time today.
Great. Thanks.